All right, so you've had ACL surgery and you've been working with your therapist on some of the foundational exercises to get you past walking, and now the next step is to get you to return to jogging, right? So in order to safely return to jogging, there's a few criteria that you have to meet. And I want to go over some of that here today, just so you kind of do an at-home test to kind of see where you're at and if you're at where you should be to kind of return to jogging, right? So this will depend on your therapist and your surgeon, but typically we want to look for a few things in order to return to jogging, right? Some of those are full or near full knee range of motion in flexion and extension. You want to have no swelling around the knee, minimal to no pain around the knee with certain activities. There's going to be some muscle, like quadriceps and hamstring strength tests that your therapist will take you through. And as well as some hop tests as well. There's going to be a few other tests as well, but some of them that I want to go over with you here today are going to be the single leg squat test and the calf raise test, because again, when we're running, when we're jogging, this is essentially a series of single leg hops, right? So you want to be able to stabilize and kind of be in that single leg position comfortably, right? So one of the tests that we're going to do is called the single leg squat test. So what you're going to do is grab a bench, grab a chair, and you're going to be standing on one leg. I'll go with my right leg here. And from here, you want to be able to kind of come down into this position and rise up. So you're going to come down, rising up. The goal is going to be 10 times on one leg and then 10 times on the other leg. And ideally, you want to see that side to side. Things are feeling pretty good, and that you're not having too much of this going on to where the knees going all over the place, right? You want to be able to control that motion as you're coming up, right? So that's the single leg squat test. Again, aiming for 10 on each side and assessing the quality from side to side. The other test is going to be over here. And what you're going to do is you're going to be doing this single leg heel rise test, right? So what it's going to look like is you can come up to a wall for balance. From here, you're going to stand on one leg, and you're going to come up on your toes and back down. Up onto your toes and back down. And again, you're going to want to shoot from between 15 to 20 and compare it to the other side, see how many you're able to get, as well as the quality of the movement, right? Oftentimes what can happen is as we're doing this, we can start to cheat and just kind of launch ourselves up there, right? So you want to maintain that good quality movement, that straight leg, coming up just using the foot here, and resting, right? So go ahead and try those tests out. That's the single leg squat test and the single leg calf raise test, and talk to your therapist to see if you're ready to return to running.